Hi, my name is Mike Hayton and I'm an orthopaedic surgeon who specialises in hand and wrist surgery. I'd like to talk to you today about wrist arthroscopy. Arthroscopy is more commonly associated with knee and shoulder, where a telescope is placed inside the joint to look at the ligaments and the bones on the internal aspect of the joint. By this time you may have already been assessed by your surgeon. Your examination and the story that you've told them may think that there's something going on inside the joint. Plain radiographs and plain x-rays can look at the bones, MRI scans can look at the soft tissues as well as the bones, but occasionally we want to directly visualise the bones and the ligaments. In this case, we introduce a small telescope inside the joint. This is often performed as a day case procedure, either under general anaesthetic with you asleep or under regional anaesthesia with just the arm asleep. Often when it's performed under regional anaesthesia, we encourage you to look at the video screen to see exactly what's going on inside your wrist so we can tell you what the problems are. Now, the problems that can occur inside the wrist are numerous, but the common ones are a tear in the triangular cartilage, and this is pain on the inner side of the wrist. We can also directly visualise the bones, and in particular the bones are joined together by strong ligaments, and in cases of trauma these ligaments can be damaged, and we can directly look at the ligaments to assess how damaged they are and whether the bones are now moving abnormally. There really are quite a lot of bones inside the wrist. Looking inside the wrist, there are many bones inside the wrist which are all tied together. Here's an anatomical model, and during the wrist arthroscopy the camera looks at each of the bones individually and the ligaments attaching them together, and we can often find abnormal movement in cases of trauma. Arthritis can also occur inside the wrist, and a wrist arthroscopy gives us invaluable information, directly visualising the articular surface. Articular cartilage is the slippery substance that's on either side of the bones. If you look at a chicken bone, you'll notice that it is nice and shiny and there's a slippery, waxy type appearance. Well, this is articular cartilage, and wrist arthroscopy gives us an opportunity to directly visualise this and see whether any areas of articular cartilage are lost. Wrist arthroscopy can predict future surgery, so we can look inside the wrist and find areas where the cartilage is in good condition, and we can utilise that for future reconstructive surgery. Surgery is usually performed under general anaesthetic as a day case or regional anaesthetic. The wounds are covered with either a butterfly stitch or a simple stitch. After 2 or 3 days, the bulky dressings are removed, and we often encourage patients to move the wrist early. However, you need to discuss this with your surgeon because some detailed internal surgery may have been performed that needs protecting. There are risks associated with any surgery. During wrist arthroscopy, infection may occur, damaging blood vessels and nerves and tendons. But the vast majority of patients, perhaps over 95% of our wrist arthroscopy, have no problems whatsoever, and we often gain valuable benefit and information from looking inside the wrist. So here on this video you can see direct visualization of the articular structures, and here's some of the white bones lined with articular cartilage, and they're joined together with these strong stout ligaments. This gives the surgeon invaluable information about the inside of your joint and how it's working in real time under direct vision.